This video brought to you by Community Hospice's Community Education Series.
My name is Dr. Beth Hodges, and I'm the daughter and caregiver for a patient that was cared for by Community Home Care and Hospice. My mom was a total prankster. She loved to play jokes on people, and she loved life, and she loved her life in our house with our family. And when she got ill and couldn't really enjoy that life as she had been, she set her own terms on how it needed to be. I spent the last few years of her life telling her how to take her medicine and how to take care of herself and what to do. And in the end, she told me what to do, which was back off and keep me comfortable and take me home. And that's what we did. My mother was my best friend, and in her last years, she was declining in health and got to a point where she did not want aggressive care anymore. She had gone from a hospital to a nursing home and wanted to come home again, even though she hadn't made much progress in the nursing home. She wanted to be in her apartment in her house and be comfortable. So my husband, who was very supportive and loving, said, absolutely, we'll bring her home, but we need more help. We need to bring in hospice. As you can imagine, it was a very stressful time because we were also trying to keep life as normal as possible for our children in the house, who only knew a house with grandma in it and didn't really understand the concept of death. Mom and I were having very open conversations about the fact that she was dying, and so I felt like we had everything under control. Went to bed, and by midnight, I was staying in her room with her. She was in discomfort, and I realized she was in acute urinary retention. That required supplies to take care of that. Although I could do the procedure, I didn't have access to those supplies, and I couldn't help her. So it was either call an ambulance and another trip to the hospital, which she begged me not to do, or I could call hospice. And by 3:30 in the morning, we were both crying, so I called hospice. And the nurse came out and was out there within 30 minutes and shooed me out of the room and got Mom comfortable, and had talked to Mom's doctor and gotten the orders, and everything was just so unbelievably more peaceful when she finished getting Mom comfortable and settled. We knew at that point it was the right decision. And I admit I was a little reluctant at first because I sort of felt that I could do it all on my own and probably still bake cookies for dinner, and that's not the way it needs to be. So we brought them in very, very quickly after Mom got home, and I don't regret it at all. Part of it is that I am a physician, and so I felt like I should be able to do all the things that Mom needed. I know all the stages of grief, I know the signs of dying, so I felt like I should be able to handle it all. What could hospice do for me that I didn't already know how to do? But by bringing in hospice, I was able to be Mom's daughter for the last week of her life and not her caregiver, and that's very important. For that week that my mom lived on hospice, I was her daughter. I was not her caregiver. I was not her doctor. I was just her daughter that loved her, and I didn't have to think about medical things or anything other than just loving her and being there with her. My positive experience with hospice has really increased my appreciation of the hospice benefit and all that hospice can do. If you have a loved one that is ill and dying, call hospice as soon as you think you're ready and they're ready, because they can provide so much more than just nursing care. The nursing care is phenomenal, but there's social work help to help you deal with some of the financial stressors. There is pastoral care. There's nurses' aides that can help with the day-to-day, just helping keep your loved one comfortable and clean. And it takes a lot of the stress out so that you can be their family member and their loved one and not just their caregiver. The hardest part is making that initial phone call, because on some level you're admitting that you're going to lose your loved one. But once you get through that phone call, it will be a very positive experience for you. And I encourage anybody in that situation to make the call.
If you have any questions about any of the topics covered in this video, we are available 24/7 to answer your questions. Call 1-800-569-1348 or visit us on the web at www.communityhch.com. Community Home Care and Hospice is one of the largest and most respected hospice agencies in the Southeast. Our mission is to provide the best care possible to our patients and their families. Our goal is to profoundly enrich the quality of life as life's journey nears its completion. Community Home Care and Hospice does not discriminate against any person on the basis of race, color, nationality, sex, age, disability, or ability to pay in admission, treatment, or reception of our services. This includes qualified veterans of any era or any other category protected by law.